White coat hypertension. White coat hypertension is not really hypertension per se, because the affected individual will have high blood pressure value while at the clinic or in the hospital. Now, looking at the doctors or nurses or medical student or nursing student, the BP will be high. A value that will always be greater than 130 over 80 millimeters of mercury. But how do we know that that will be the case? If such individual has any record of home blood pressure monitoring or ambulatory blood pressure, those two will be within normal range. Anything less than 130 over 80 millimeters of mercury, meaning the high blood pressure will only be when the BP has been taken in the presence of a medical personnel wearing white clothes or white coat. Then it is known as white coat hypertension. Let me briefly explain again. The BP at the clinic or hospital is a bit high, higher than 130 over 80 millimeters of mercury. But the same individual, when you go through the report brought as per home blood pressure or the report as per ambulatory blood pressure, they will be within normal range, or at least nothing up to 130 over 80 millimeters of mercury. Then you arrive at that conclusion. The BP in this person is only high when he or she is in the presence of medical personnel. Now, more information here is that sometimes it is called labor hypertension because it is not sustained, or white coat syndrome because seeing the nurses, doctors, medical student, nursing student in the white apparel will trigger the anxiety in him or her, and then shooting the blood pressure up. So the individual is not truly hypertensive. No. It is only due to anxiety. Please don't let us continue to make the wrong diagnosis of high blood pressure in such people. Why that? That will lead to wrong treatment with associated side effects of the medications. What do we need? How do we get out? Let's have psychotherapy because it's due to anxiety. And let us always check with the ambulatory or home blood pressure monitoring parameters. That comes to the end of this short presentation. White coat hypertension could be easily handled with psychotherapy. Thanks for listening. Please remember to subscribe to my channel. I appreciate it.